Dr. Casperson, I'm so excited to be doing this interview with you. Welcome to the Fempower Health podcast. And I'm excited about our topic, which was inspired by looking through the things that you discuss, the re-release of You Are Not Broken. And, some of the things I've been hearing about people's sexual experiences in this perimenopause, menopause stage of life. And I thought it'd be so interesting to help people understand there is hope and this is not the end of our lives. This is actually a wonderful time in our lives, and I can attest to it as well. And so I thought, because of your amazing personality, I thought you are the perfect person to have this conversation with. So thank you for joining.
Thanks for having me. Yeah, I think I was just telling somebody, like, it's wonderfully optimistic that we've called this part of life midlife. Like, to really think about that is like, dude, they're telling us this is mid. So we need to change our frame, I think, on how a lot of people think, like, this is just how it's going to be, or this, it's like, no, this is half. If we do it right, this is half. So
Exactly.
start thinking big.
Yes. And I have high hopes. My grandmother, she passed away last year, but she was 100 years old and I'm at 50.
Amazing.
So I'm literally midlife.
See? Midlife. I know. And for like 4 or 5 of those years, you were in diapers. You couldn't tie your shoelaces. Like, you get to be all adult for the second half. It's pretty nice.
Yes. No, absolutely. So while I do a pre-recorded or a different recording of an introduction to this episode, I would love that gives all your background and stuff. I would love for you to introduce yourself for those who may not know you, and then let's dive into this topic.
Cool. So I'm Dr. Casperson. I went to undergrad and med school at from Minnesota, and then did urology. So 6 years of a urology residency, which is the surgery of the genital urinary organs, usually male genitalia, but more now female genitalia as well. And I was 7 years into practice, so done with residency, took a job, and was getting kind of bored. It's like, what did you do all this training for? To just tell people to, like, urinate regularly and drink more water? And so it was getting a little bored. And I think that's when the universe was like, you're ready. Like, you're ready for the next thing. And a woman came in and crying. And I was very bonded with her. I knew her well. I had taken care of her for a while. So this wasn't some stranger crying that changed my life. It was like somebody I deeply cared for. And I was handing her the box of Kleenex. She was crying about her sexless marriage. And in my head, I'm like, I don't know how to help her. And furthermore, I was trained in urology that the gynecologists were taking care of women. Women were too complicated. Furthermore, they talk too much in clinic, and we'll never figure them out. And so, like, that was what came up when I'm like, I don't know how to help her, but does anybody know how to help women? And so that's when I started my education on what does the research say about female sexual health, female sexual dysfunction, what's available, why, how common is it? And started finding good research, and then realizing it does not trickle into mainstream media, mainstream people. We just get hounded by Hollywood that tells us that simultaneous orgasms, equal level of sexual desire between partners, you should always feel hot for sex all the time. Like, Hollywood really misleads us when it comes to adult sexuality, especially in a long-term relationship, right? Which is rarely depicted in Hollywood. And so I just learned all this, and I was like, I need to talk. And so started the podcast 4.5 years ago. Wow. Self-published a book because I was like, I just need to get this out. Right. Yeah. And I basically wrote the book that I didn't see that existed, because this needs to be approachable, funny, easy to digest, with practical tips to be like, listen, we've got science. You just don't know it. And once you have the knowledge and are empowered, then you go running.
Right. Absolutely. What would you say some of these myths are? Like, I've done a lot of sexual health related episodes, and, we know that women don't orgasm as much as we say. There's just a lot of myths around some of these facts. And so I guess I would love to know some of the things that you've brought up in your book that you think is so important for people to understand beyond just some of these facts and figures, because I don't know if the facts and figures are sufficient. I feel like there's the layer underneath that I think maybe gives us a better aha of you're not alone. and that there's things that can be done.
Yeah, I mean, one big myth is that orgasms are more difficult or are challenging or take longer for women. They don't. When women are by themselves, they can orgasm quite fast and fantastically. Not that fast is better. I think we get into this like comparison or like that is this wonderful thing called sex has to be done sooner, right? It's very odd. But so that's a big myth that like, oh, I can't orgasm just because women's bodies are more difficult. It's like, no, women just are socialized to not understand their bodies sexually, like men are socialized very early to understand their bodies sexually, right? So we have a gender discrepancy in who's allowed to be sexual, who's allowed to discover their body, who's allowed to masturbate. That I think perpetuates. Another big myth is that women should orgasm by putting something in their vagina. No, that's not true at all. The clitoris is the organ of pleasure, and if we ignore it, it's like, you always compare it to a man. It's like rub a man's scrotum and see if he has an orgasm. Like, it's close, isn't it good enough? Right? And then that usually elicits a laugh, and then you're like, yes, that's what women are doing, right? They're rubbing their thigh or their vagina. So that's another big myth. Another big myth is that sex is supposed to be painful or should be painful, or there's no good treatment for that. Another big myth is that both partners should have the same amount of desire for sex. That sex means the same thing to everybody, right? And I think the overlying, basically all sex problems come down to the inability for us to communicate about it, whether that's with our doctor or with ourself or with our partner. Like, once people are like, oh, you're so easy to talk to about sex. It's like, look, I've been talking about it for like 5 years now, right? Like, it's just a thing. And the uncomfortableness does improve the more you become fluent in talking about sex.
Right.
I just think, a tip is like, if you're talking to your partner or your doctor about it and it's uncomfortable, say it out loud. This is uncomfortable for me, right? Like, it's even saying that kind of helps get the shame out of there, or it helps people be more compassionate to like, it's
Mhm.
okay, I got you. Like,
Yeah,
I'll give you
exactly.
some space.
And you're right. And I'm thinking even when you were saying about how you've been talking about this for so long, which makes it so easy for people to talk to you, I will tell you, do you know how many people come to me and tell me their most intimate details with sexual health because of the things I talk about on the podcast and how open I am, which I feel so honored that they're willing to share. But I think about even my own life. Like recently, I got a pessary because I'm training for the marathon and I'm 50 and I'm noticing some changes. And going to the appointment to get fit for a pessary is quite interesting and vulnerable.
Mhm.
And luckily, because I kind of know the drill and know these experts and know what they're thinking, we actually just giggled and laughed. And it was two women. One was the doctor and one was the PA. And we were all in there trying to help me get sorted out so that I don't have issues as I continue training for this marathon. And it was a wonderful appointment. And they actually enjoyed it too, because we all just were like, let's just figure this out. But then, when it comes to the sexual health pieces, I guess because I am talking about it and hearing this from you all, I'm even looking back and reflecting on my own life. And, you know, you're right. I think we are not taught to be comfortable with our own bodies. I don't know if that's changing now for those in the younger generations. Um, but I will not lie. I was so terrified after my ex and I split up, and I was doing all these interviews with all of you about understanding how our bodies change as we get older. And I literally was traumatized and in tears because I thought, oh my gosh, my prime is done. And I was terrified. But now what I'm realizing is you all have such valuable information to share. And as we hit 50 plus, we are so much more confident and able to talk. And you are 100% right. The communication pathways that I've had since I split with my ex are night and day. The support you all have provided around things we can do to deal with vaginal dryness and all these other things that can happen as these hormones change, it's incredible. And so you're absolutely right. And I'm experiencing it. And it really is a gift. Like, it's an amazing life. And I'm
Yeah.
50. Like I feel more better than when I was 20. Seriously.
Yeah, I mean, there's an amazing book called Magnificent Sex by Peggy Kleinplatz, and she basically was like, "Hey, who is the self-selected who's good at sex, right?" So these people like raised their hand and filled out her form, and she interviewed them. By and large, they're older, and by and large, they're excellent communicators.
Yep.
Not nowhere, and she says this in the book. She's like, "No one is good at sex because they have spontaneous desire for sex. It's like not even a prerequisite." And then all of the amateurs are like, "I don't have desire for sex." And all the experts are like, "Well, just go have sex. Like have sex worth desiring, have pleasurable sex. We're not telling you to have not consented sex, but it's like you got to go get in there and play and like learn and people sitting on the couch is kind of like exercise, right? Like if you waited on the couch until you sat around to desire training for a marathon, that's not how marathons get run, right? It's like, no, I want a marathon in my life, so I need to do these things. Is like, you can't sit around waiting for the desire to happen. And the experts will be like, no, spontaneous sexual desire, not part of why I have great sex at all.
So I guess with the patients that you're working with, I mean, I'm an N of one, you have N of many more. What are you seeing as maybe the challenge in getting over this hump that seems to really help people who are struggling?
Yeah, I mean, I realized pretty early on that like I can make your pelvis perfect, right? Like I can give you great hormones, I can give you wonderful lubes, I can recommend amazing vibrators. I have amazing pelvic floor physical therapists to help with laxity, pain, things like that. I can get the skin looking really good. But if your brain isn't thinking about sex right, you grew up in a culture of shame, you grew up in a culture of sex is it starts this way, you put something in your vagina and it ends when the man has an orgasm, right? A very, what we call heterosexual linear model of sex. So it's like your brain and how you think about sex is incredibly important. And me giving you a perfect pelvis isn't going to make you successful. And so that's where I was really started diving into like your thoughts about sex matter. Your thoughts about your body matters. Your ability to prioritize sex, right? Like you can't have an amazing sex life if you don't prioritize any time to be intimate, right? And I think so many people, especially midlife people, is like people are busy. We're very busy, probably to our detriment. But it's like when they come in and they're like, I have low desire, but they're working the night shift, they're working 2 jobs, they never see their partner. When they do, there's conflict. They've got young kids at home that they're mothering, right? It's like spontaneous sexual desire doesn't exist in that life. You really do have to work to say, I want to prioritize sexuality. Right. So it's like, I can make your pelvis beautiful, but you have to do some things to incorporate healthy sexuality in your life, including really understanding what you've been taught to think about sex.
Yep. And I guess, how do people get to that? Do they need to go to a therapist? Is it like how have you found people have been able to figure those pieces out?
Yeah. I mean, that I talk about it a lot in the book, right? And journaling of like, hey, what were you told about sex growing up? Right. I don't think everybody needs a sex therapist for this at all. It's really, I call it adult sex ed, right? It's like when you were maybe a teenager, 8th grade or whatever, you got this is what sex is, and this is how to prevent disease and pregnancy, right? So you got a disease and pregnancy prevention plan. You probably weren't even sexually active at that time, but that was the information you got. Then you grew up, you had a relationship, you learned a crap ton, good or bad, from the early relationships. You took that with you. Maybe you added on some more knowledge. And then you get to the midlife and you're like, I feel broken. Like, or I don't have any desire. Or sex for me is just awful. I'm just laying there, whatever it might be. Right. And it's like, well, you didn't actually get any sex ed that's going to help you be a successful adult in the bedroom. You got no sex ed. Right. And so it's just, oh, I think I'm broken, but perhaps I never learned anything in the first place. Right. So it's just a little bit of education goes a long way in being like, oh my God, I've been having this type of sex that doesn't even serve me. Now I got to talk about that. Right. Like there is some level of work, but to me, I'm like, what the skills that you get in figuring out your sex life is like, number one, the highest form of personal growth, right? And number two, it's like, it's only going to serve, if you learn how to communicate about difficult things, that's going to serve you in your family, that's going to serve you at your job, that's going to serve you all over the place, right? So the skills that you have in learning to have a good sex life is only going to trickle over and help everywhere else. But
Right.
learning, what do you want? How do
No,
you
it's very,
communicate that?
yeah. No, you're right. I mean, I journal every morning, and you're right. It's like, I think that's where it really begins, is what do you want? Because, I'm thinking of people who have shared their relationship dynamics. I'm thinking of some of my own. And, I will say, I'm curious in your reaction to this is, what about if we all just got vulnerable and then did the thing we discussed earlier, which is communicate? Like, I'm thinking of two things. One, um, I was in a relationship where I will never forget, this has never happened, and I'm 50. This was not that long ago. And I was like, I'm so terrified about what we're about to do. And he was like, so am I. And I was like, should we just wait? And it was just like, I've never had that kind of a conversation. It's usually like, you just, get in a mood and there you go. And it was so fascinating to be incredibly vulnerable with someone, because then the communication about everything else was so incredibly easy. This is what I like.
Yeah.
This is what I don't like. Blah, blah, blah. Try this, not that. And it was so unbelievably, because I've never been able to do that.
Mm-hmm.
And to draw a different parallel, so people may be like, seriously, I can't do that. I was recently listening to the Hidden Brain podcast, and I listen to it religiously every week because somehow the topic they have that week is exactly the topic I needed to hear. And so a recent one, this gentleman was talking about, I don't remember exactly what the episode was. I think it was just about communication and vulnerability. And he went to this seminar where he led a group of venture capitalists through an exercise. And he had three questions. And it was like, tell us the last time you cried in front of someone. Tell us if you had a crystal ball, what would you want it to tell you? And there was like another question, I don't remember off the top of my head. And he said in the beginning, everyone was like, what? And they were like cursing, like, we're not doing this. And then they started to do the exercise, and he gave it a 10-minute time slot, and he couldn't stop them. It was 20 minutes before they finally stopped. They were hugging. So that vulnerability, I think we all crave. It's just like, when are we going to take that step? These bankers, they're like, they just want to make money, and they're sitting here crying and hugging. And I wonder if that's a lot of this, is just getting to that place where we know what we want. And because we are so clear on that, it makes it easier to be vulnerable, to have these observations, whatever the outcome is. I don't know. A little
Yeah.
deep
Well,
there, but I'm curious what you think.
yeah, well, I think, I agree with you. I think so many people want intimacy and they think intimacy is in the nakedness. And it's like, no, intimacy is actually in talking about the nakedness, right? Because it's like, it requires, you need to learn how to be a good listener. You need to learn, because it's not only you talking, you have to then listen and make sure you're understanding the other person. And, that's an amazing connection that I think people want. And the other interesting question for partnered people is, do you know why your partner wants sex? Or what does sex mean to your partner? Because I will guarantee you, in a partnered relationship, it means different things. You're doing one thing, but it means different things. Stereotypically, in a heterosexual partnership, sex means closeness or intimacy to the male. Whereas in the female, she needs to be close to then want to have sex. Right? So he uses sex as a way to get close. She needs to feel close in order to want to have sex. And it's like, if that's not communicated well, you're not going to get anywhere.
That's true.
But yeah, I was 10 plus years into my relationship when I was like, what does sex mean to you? And he told me what it meant. And I was like, that's good information to have. So it's like, people spend years and years and years not even knowing what this means to the other person. And I think it engenders tons of compassion to be like, I now understand how important this is to you. I know why it's important to you. And I want to make sure we prioritize this then.
Yep. You know, I guess it's interesting because one of the things I've realized, even from the business world as well, is I have over time gotten so confident asking questions that it seems like no one wants to ask. But when I ask them, everyone has that question. And so over the years, I just get more and more and more and more confident because I'm seeing constantly that people are like, oh my God, I was wondering the same thing. And I'm like, I thought it was a dumb question. And sometimes I do preface, this might be a dumb question, but um, so I'm curious, like other questions, like what other questions could we ask ourselves or our partners or potential partners to have richer dialogue about what this could look like and what we need.
Yeah. I mean, I think going back to the question of like, what do you want? So many people don't know what they want. Right. And it's kind of then it's good to know that you don't know what you want, because how are you supposed to fulfill that need? Right. But sometimes it's hard to answer that question because you don't know what you want. It's like if you just had chicken your entire life and then you go to a restaurant that has like a complete menu, you're like, I have no idea. I've just been doing chicken like my whole life. How do you know? Right. So kind of an easy way to flip that is to be like, what don't you want? Like, okay, well, I don't want to have sex in a football stadium. I don't like it when there's a lot of distractions. I don't like being cold. Right. So you can kind of like, and then you can flip it to be like, I'd like it to be quiet. I'd like to feel safe and warm. I'd like to, blah, blah, blah. And then you can kind of like rig it by realizing what you don't want, which is sometimes a nice exercise because women are like, I've just been having mushy broccoli sex my whole life. Okay, well, what's the opposite of that? Right? I want somebody to pay attention to me. I want talking first. I want a bath first. And really realizing like sex for a lot of people, especially as we age, isn't just a light switch. You can't be like, cars off, doors are locked, sex. Right? Of like, especially the busy, busy, busy people, of like your nervous system is on sympathetic overdrive. What are the kids doing? What the meetings tomorrow? Do I have the PowerPoint get put in? What are we having for dinner? Well, and then at the end of that, if your partner's like, you want to have sex? You're like, no. Like your sympathetic nervous system is like on. And what works for running a busy life doesn't work for orgasm. Like, they've done MRIs of orgasm brains, and like the frontal lobe goes dark. Like you can't be planning and have an orgasm at the same time.
So is this really more about also just accepting where your life is and not beating yourself up and setting realistic expectations as well? Because, as you were talking, I'm like, well, what do we tell those in midlife who are busy people? And I think it's going to be individualized, but at the end of the day, I think it's this expectation because I know I feel like there are these perhaps unspoken expectations of how many times and how long something should last and all of these things. And it's like, but it's your life to find it how you
Yeah,
want. But if everyone's
totally.
guessing, then you're kind of holding yourself to false standards
Well, and
anyways, right?
it kind of wrecks the whole point of sex,
Right.
right? Like because people are like, we have to have sex 2 times a week, and it's got to be on Tuesdays, and it's got to last 37 minutes, and I need a new piece of lingerie every time. And it's like, dude, you're like literally, that's literally not what sex is, right? Like, sex is a time for connection, a time for I'm not telling you what sex is. Sex is different for everybody. For some people, it's a stress relief. For some people, it helps them sleep. Like, sex is many different things, but when you make it a to-do list, or you make it good wives do this, or 47-year-olds do this, or like, all that, people are like, how often should people have sex? And I'm like, you're just making it like 5 fruits and vegetables a day and 30 minutes of cardiovascular exercise and 8 hours of sleep. Like, it's just a to-do list. And again, that's not where pleasure lives. You can't to-do list sex.
Yeah.
You can
Well,
prioritize it, but you can't to do it. Like, it's just a
right.
chore then. And that's like the opposite of what pleasure and desire is.
Right. And I think outside of even sex, I think at this age, what I'm seeing is so many people are just busy, full stop, and are struggling even with the basics of self care. And trying to add this to that can be a lot.
Yeah.
Anyhow, let's talk about this one part where I know folks at this age who are like genuinely struggling, where there is a complete mismatch in desire. Now, I
Yep.
don't know if that is beyond the scope of what we can cover in this podcast in any depth, but I'm just curious for people who are like truly at this mismatch, if you had like tips for them. And then what I wouldn't get into is our bodies and the structure of our bodies and how it's changing so that people know, okay, now that I've got through the emotions of it, what's going on with my body, and let's help me with that as well. So for the really
Yeah.
complicated like mismatch,
Yeah.
any
I normalize
recommendations?
it and be like, you and a partner probably don't like the same amount of much. Maybe you both like brushing your teeth twice a day, but like one likes long walks, one likes the weight room, one likes pizza more, one loves brunch, right? And really understanding we don't try to match everything else. One needs 8.5 hours of sleep, the other one's fine with 7.5 hours of sleep, right? We don't try to match you perfectly with anything else with your partner except for sex. Like there's a stereotype of like, you guys need to like sex the same amount your entire life. And it's completely unobtainable. It's not how humans work, right? So just normalizing that desire mismatch tends to be the default, right? But some people just get into big pickles with it. And the problem gets when we say, you need to match mine, or you're broken because you don't match mine, thinking that it's one person's fault. And really the experts on this say that desire mismatch is a couple's problem. It is not one person's problem. And we were talking earlier about like who needs the sex therapist. When you're at the point where it's been sexless for a long time, there's a lot of like shame, or there's a lot of just kind of built up, not aggression, but like built up sentiment about how you think each other should be. That's where the pros can really help you navigate that, because you've kind of gotten yourself into a pickle at that point. And it might be very hard to listen, and it might be very hard to try to find the middle ground. And that's where the sex therapist really can help people get out of that pickle. So
Right.
that's what I would say about desire mismatch, of like normalize it, see if you can make it work for what does the partnership need. And not just what I need, because I do have a responsibility to take care of myself for some of this. I can't make all of my desires land on one person, right? Who might not be able to match that level. But yeah, sex therapists are amazing. They're basically just therapists who are comfortable talking about sex. So I didn't know, like, a lot of therapists aren't comfortable talking about sex. They're like, oh, they're just like doctors. Not all doctors are comfortable talking about sex, right?
Okay.
So yeah, that would be my advice for the desire mismatch. Super common. If you're in an insurmountable pickle, get a pro at that point.
Right. Yeah, it's interesting. I feel like it still all breaks down to communication and vulnerability, but I agree, like when life gets in the way or emotions are strong or you're stuck in the middle of something, it's really hard to see through that when you're in the midst of it. Like it's easy for us to be on the
Yeah.
outside. Well, da, 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 da.
And how many people, this would be an interesting study, but how many people with significant desire mismatch don't know what sex means to the other person?
I like that. I'm going to give this advice to someone who may need it.
It's just, it just helps. Like, if you can understand, oh, you're seeking closeness and validation of my love for you. I didn't know that's what sex meant to you. That's good to know. How else can I give you love and validation that isn't always sexual in nature, right? And it's like working through stuff like that.
Okay. I love that. So now let's talk about how our bodies change at midlife and what we
Yeah.
should be expecting. So
Yeah.
you dive into that, and I'm
Well,
happy to bring in some personal examples and experiences as well.
cool. So, I think we get taught about puberty a lot more than we get taught about midlife. When we think about a menopausal woman, we think about a 75-year-old like Golden Girls, right? When we say we don't get any education about sex, that's true, but we really don't get any education about menopause. And so many people, and I'll flip this for all genders, 40% of men have issues with erectile dysfunction by age 40. So their bodies change too. everybody's bodies change, but the ovaries have a profound change in the drop of their hormone production. And the hormone production is estrogen, progesterone, and testosterone. Many more, actually, but those are the 3 commercially available hormones. So we talk about them a lot more. Many people think that menopause is just a hot flash and the end of periods. And that's actually what happens as a result of hormones getting low. That's not actually what it is. It's just a sign of what's happening. So the ovaries will run out of their jobs anywhere between early 40s, sometimes late 30s. Average age of menopause is 51. But there are people who are, they breeze through and they still have periods till they're 58. So it's a big range. And what's happening is the ovaries say, I don't have any more hormones to give. And that lack of hormones profoundly affects the entire body, the brain, the heart, the vulva, the vagina, the bladder, the inner ear, the bones, the muscles, all the things, your gums, your dental health, right? So it's everything, and people don't know that. And again, it's kind of like sex. Like the more you just get educated and kind of learn about it, the less scary or awful the whole thing is. Of like, we don't know why. And it's not just humans. Many animals will stop being reproductive before they die. They think that's probably evolutionary's way of like making sure that you get your reproduction in before you die. Is like that ends first before you die. And so sexually, what happens is you can get more low desire because estrogen's important for desire, testosterone's important for desire. Certainly your relationship and your upbringing are important for how you think about sex too, but for hormones, they do play a role in desire. And then genital urinary syndrome of menopause. So pain with sex, more trouble with arousal, more trouble with orgasm, more trouble with, comfort because the skin gets thinned and dried. Very fixable with both lubrications and hormones, vaginal hormones specifically for that. Genital urinary syndrome of menopause, 60 to 80% of women. We don't know why a minority doesn't ever get that problem, but most people will get that problem. So experts like me, we talk about preventative hormones, right? Like, I don't want you to come see me when you stopped having sex 8 years ago. That's too late, right? And so really talking about like, if we know this happens to the majority of people and they want to stay functioning, should they just start vaginal hormones at a certain age? What age would that be? I don't know, maybe 55. Certainly sooner if you start having symptoms.
Yeah, so it's funny. I actually started the tablet, the vaginal estrogen tablet,
Mm-hmm.
and I didn't find that it was doing anything for pain with sex. I didn't have a lot of pain, but pain with insertion just a little bit,
Mm-hmm.
and I'd never had it before, so I knew it was something new. And I ended up switching to the vaginal estrogen cream. World of difference, and I don't do the tablet at all now.
Way better. Tablets
Yeah,
don't help everybody.
yeah, that's what I'd heard.
Especially when you need to target your vulva, right? I always tell people it's like putting a piece of birdseed in your ear and of sunscreen and expecting your face not to get sunburned. It's like, it's just not enough estrogen.
Yeah.
And it doesn't target the entrance thinning like the cream does. And the cream's great because you can put it on your labia, you can put it on your clitoris, help preserve those tissues. Again, when we think that menopause is just a hot flash and your period's ending, we don't know our clitoris shrinks, our labia minora can go away. And then women are like, oh, nobody told me that. I'm like, well, because you didn't get an adult sex ed, right? That adult sex ed includes those things.
Yeah,
so
exactly.
Then you're like, oh, I want to preserve those tissues. Okay, those tissues need estrogen.
Well, what about taking the tablet and the cream? Is there a reason for that or no?
Some people need more.
Okay.
I think we're all different in what our tissues need. So I have some people, they do the tablet and the cream. I think for a lot of people, the cream's enough. But again, I don't have people coming to me saying, I just want to let you know that the tablet's great. Right?
Wonderful.
Like they usually come to me and they're like, I still have pain with sex. And I'm like, that's because you're using really, really low dose hormones.
Okay. Got it. Yeah. The cream has been world of difference. And I'm
Yeah,
50.
we love.
I started taking, go ahead.
Oh, I was just going to say, and it's cheap. Vaginal estrogen is cheap. If your insurance makes you pay an arm and a leg, have the prescription transferred to Mark Cuban Cost Plus Drugs is a great nationwide one. It's like $13 plus $7 shipping.
So what is the latest on trying to get the FDA to change the black box warning?
Yeah. So the group I'm part of a task force. It's called Unbox. I think they're going to release it in September, so it's going to be exciting. But I think it's going to be called Unboxing Estrogen and
Nice.
getting the boxed warning off of vaginal estrogen. So long story short, after the Women's Health Initiative came out and some scary stuff about estrogen came out, which we now know is basically all been walked back. The FDA said we need to put a warning label on all estrogen products. We don't care about the dose. We don't care that you're not swallowing it. We don't care that this is just for skincare. The warning needs to go on everything. So on your boxed estrogen label, if you were to ever read it, it says probable dementia, blood clots, heart disease, stroke, and breast cancer. That's not possible. This is a low dose. If we took your blood level of estrogen and we started you on this medication and we checked your blood level of estrogen a month later, we wouldn't have moved the needle. So it's impossible that it's going to cause these other things. But it's on there. And if I don't tell you, you're going to read this warning label and it's going to scare you and it's all wrong and we're working to get the label off. If a doctor doesn't take the time to tell you that, you're going to read this label and say that my doctor's trying to kill me. This isn't worth it. Extra bonus if your insurance doesn't cover it well, so it's $200 a tube because you don't know you can get it cheaper. Like, you're not going to use this product.
Right. No,
So
absolutely.
we're working to get that off. What's that?
No, go ahead. You're working to get it off.
Oh, I was saying we have so many studies on the safety of vaginal estrogen now that I think the FDA, because the government's actually very interested in getting rid of disinformation. So we're basically like, this is horrific disinformation. Can you please help rectify it? You put it on there. Can you please take it off?
Okay. Well, I'm excited that that you guys are doing this, and it's so important. I will tell you, it's funny you were saying about if the doctors don't educate patients, because every time I go in to get my hormones at the pharmacy, I always get, hold on a second, hold on. I have to go talk to my manager, and they like go away and they come back and they're like, do you realize that you're on da 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 and this risk? And I'm like, I got it. Can I just pay, please? But
I know.
that's because I'm talking to all of you. Like, imagine people who just get the prescription, have no idea about this, show it, and they may get scared and then not get the help that they need that would change their life.
Yeah. Yeah. I mean, so pharmacists are not educated on the safety of hormones. And, I talk to them. I'm like, you guys, why are you doing this? Right. And they're like, listen, in our computer programs, a warning box comes up and we have to check the box that we blah, blah, blah. And so it's like, it's almost become automated in that they have to do these things, even when they're like, yeah, I know, it's fine. But that's a big myth that you can't be on systemic hormones and vaginal hormones at the same time. Absolutely, you can. Systemic hormones are still very low dose. Very low dose.
Yeah, no, absolutely. And then what about how would you say the role of vaginal moisturizer plays in this? And I say this because there will be people who are going to be afraid to take the vaginal estrogen, even though we know generally speaking it's safe. And there may be other reasons as well. So there are these vaginal moisturizers. Tell us how the consumer should view those as playing a role.
Yeah. So vaginal moisturizers are basically like for daily comfort, right? So they kind of separate themselves out. They're not like a sexual lubricant, which is a different product, usually more slippery. But the moisturizers go in the vagina, usually at like a hyaluronic acid based, which is really hangs on to moisture a lot, right? So it kind of keeps the moisture on the top of the skin, is how it works. Great for comfort. But again, everything comes down to education. As soon as you're like, well, yeah, it helps it feel less dry because it's hanging onto moisture, right? But it's not solving the problem or the reason why it's getting thinned or irritated in the first place. Is it's starving for hormones, which help blood flow and collagen, right? So you educate a woman and then she can make better decisions. Fear is not a great way to live your life. It's not a great way to make decisions. And by and large, I know women are incredibly smart. They just need the information.
Yeah.
And so for me, vaginal moisturizer is great. If you love them, it's a great product. You don't mind them and they're not too messy for you. Like they are not going to hurt you at all. But a lot of women, when they get on the vaginal estrogen, they're like, I'm good.
Yeah. No,
Like,
it is
I'm fine.
quite amazing.
Some women need all the things. They need the vaginal estrogen and the moisturizers. So everybody's different, but make your decision based upon what works and not from a place of fear, because you're limiting yourself for stuff we have so much safety data on.
Yeah, no, exactly. And by the way, one thing I was realizing is we're because we can't cover everything in great detail in a short amount of time, but we also have to acknowledge that these are proactive measures. But there's a lot of reasons why someone may have pain with intercourse. And I actually interviewed Dr. Jill Kraft, who talks about some of those. Then I just interviewed Dr. Dubinskaya, and she talks about the rare-ish causes of pain with sex. And so if people want to dive deeper into like other reasons, we just cannot cover all that now. This is much more around midlife, preventative things. Fair point.
I mean,
Okay.
I would say, just to throw it out there, the two most common reasons for pain with sex in midlife, one of them is, decreasing hormones. But the other one people don't talk about is lack of arousal. So if you just start sex by putting something in your vagina, it's more likely to hurt, right? Because what arousal does is it lengthens the vagina and tips it back a little bit and brings in blood flow, so you have more like resiliency in the tissue. And if you've just been taught that sex is for somebody else and just put something in your vagina so you can start having sex, you're much more likely to have pain with sex than if your body's turned on, aroused, you've got blood flow going down there, and it's a lot more comfortable. But I think, again, we didn't get sex ed. Nobody's going to teach you, like, turn on your pelvis before you put something in your vagina. Otherwise, it's like, what is this? Is this a tampon? Like, what's she doing? Is this a pessary? What does she want right now? Right? Of like, give your pelvis a heads up.
Right.
And things tend to be a lot more comfortable there too.
Yeah. No, that makes sense. So we talked about also trouble with orgasm. Why does that happen at
Yeah.
this
So
later
that
stage in
about
life?
10% of women have never had an orgasm. Of that 10%, the majority, like 9%, is they just haven't been taught or encouraged. They don't know what the clitoris is, or that the clitoris needs touch, vibration, arousal, whatever it might be. So a lot of it's just lack of education. But then let's say you've got the midlife person and she's like, I've been having great orgasms my whole life. I actually really like orgasms. I know what usually works for me. And now things have changed. Right. So that's a different scenario than the woman who's like, the clitoris exists. Right. Hormones are hugely important. Women will notice this. They'll like, you'll have a baby and you'll be breastfeeding. Right. And you're like, the orgasm does not live where the breastfeeding does, because the hormones are all completely messed up trying to produce milk. Right. So you might experience that in other times of big, profound hormone changes. But certainly estrogen, testosterone, you can have skin conditions, you can have, clitoral phimosis, which is where the hood, or the basically foreskin of the clitoris gets fused over the clitoral head. So women will say, I feel like I'm trying to have an orgasm through like a quilt blanket, right? Like there's something in the way. So if you can find somebody who's good at exams, can make sure that there's clitoral atrophy, clitoral phimosis, or just lower hormones might be going on.
Interesting. And
But
this is
in the
not
aging
something. Go ahead.
I was just say, in the aging process, if you have comorbidities, right? Are you a smoker? You've got a blood flow issue. Clitorises can have erectile dysfunction just like penises can. We just don't research it. We don't talk about it. People with diabetes, because of the neuropathy, can have diminished sensation and arousal, right? So there can be other things going on as well.
Okay. So then from a hormone perspective, if it is hormones, the vaginal estrogen wouldn't be helping, or should we say if you're taking vaginal estrogen and it's not helping, it would be a different hormone?
Yeah, it can help. But again, orgasm's complicated, right? You got your end organ, you've got your clitoris. Is it well estrogenized? Is it healthy? Is it not atrophic? And you got to go up, right? Is it the brain? Are there hormone changes in the brain? And so orgasm can be a lot of different things. We are horribly understudied when it comes to orgasm, but there is some data in the role of testosterone. There's also some data in the role of the medications used for low desire. So off-label use, but flubanserin, specifically Addyi is the brand name. There's some cool orgasm data coming from that drug, and that drug works by increasing dopamine in the brain. So to get a doctor who knows all of these things, right? Like, you don't learn this in medical school. So like really I would say if this is you and you're looking for help, go to the ISHWISH website, which is the International Society for the Study of Women's Sexual Health, ishwish.org. You can type in your zip code. And the benefit of going to one of those providers is that, number one, they care deeply about sex med, but also they're pretty versed in hormones because they understand the role of hormones in a healthy sex life.
Yep, absolutely. Now, is it usually urogynecologists who are also members of ISHWISH, or what's the subspecialty?
ISHWISH is across the board. I mean, that's one of the
Okay.
reasons it's such a cool organization, is it's so multidisciplinary. So you've got your psychiatrists, your sex therapists, your OB-GYNs, your internal medicine doctors, your family medicine doctors, your urologists. Like, my opinion is everybody should be comfortable talking about hormones, because 50% of the population loses their hormones in midlife. There is not enough gynecologists, let alone urogynecologists, in the country to deal with 50% of the population.
Yeah, no, I agree. And I went to ACOG this year, and I was talking to some folks like, you have to go to ISHWISH. It's on my list. I was
Oh,
going to
you
go
have to
this
go
year,
to
but I couldn't.
ISHWISH.
It's yeah. I hope to. I assume you go every year, so hopefully I'll meet you there
Yeah,
face to face
it's
next
in
year. But I
Atlanta.
really,
It's in Atlanta in 2025. It's magical
I know
as far as
everyone says
medical
good
conferences
things.
go.
Otherwise known as Hotlanta. So I grew up in Florida, and so we did some activities in Hotlanta. So,
Yep.
but no, this is really really helpful. So to summarize, what I'm hearing from all of this is, we need to get ourselves to a place of being able to have the dialogue first with ourselves, and ideally with our partner if we have one, to figure out like what we want and need, and that midlife isn't the end. It actually could be a beginning, to something
Yeah.
amazing, because there's so many tools, and our confidence levels and the way we view our lives and ourselves and those around us. We may be busy, but the confidence, I think, is so different, right?
Yeah. I mean, well, I think, especially for females, we've really taken on a passive role for sex, a lot of us, right? Of like, what do we think it is? What if people told us? What if our partners, what do they want? I'll just do what they want. Like, we really kind of take this passive role. And I think the cool thing about midlife is you're like, is this all there is? What do I want? What do I want?
Right.
Like, really this questioning, this curiosity. And it's like, curiosity and playfulness are what adult sex is,
Yep.
right? Of like, a lot of people in midlife, they're not trying to have babies anymore, right? So what is sex? What is it for? Why do you want it? Why is it important in your relationship? Like, these are big questions, but like, when you get on top of that, the confidence of like, yeah, we get busy, but we want to stay connected this way, and this is how you have an orgasm, this is how I like to have an orgasm, sometimes we do that together, like, really getting on top of like, this is your life, this is your sex life, this is not anybody else's problem to solve. And for people who don't want that, that's perfectly okay. It's okay. You don't have to have anybody else's sex life.
Yep. No, it's true. And I have to say, like, just reflecting back on the fortune of my having interviewed all of you and reading your books. I haven't read yours yet. Usually I read the books before, but I didn't realize about your re-release until it was too late. But I will still read it, just not before this interview. Um, is just, you all are so right. And I really hope that people take to heart what we discussed today, because I know that you all know your stuff, and I've tried it on. And it's really changed my life. I try just about everything you all say, and I actually recently did an episode where I talk about my menopause journey, and I weave in like some of the tips. But I also say this is not medical advice. This is my life. But just so you know how I learned about these things, and I'm just so grateful, because it is each of you who is working so hard to make sure we have the information we need and deserve. And, I know it's taking a long time to transform women's health, but we're getting there one person at a time. And I will say it's worth it to try on all the things you said, even if people may be afraid.
Yeah. Well, yeah, and I think, like podcasts like yours of like women need to hear it, right? Because it is scary. And they're like, "Oh, well, if these women can figure out their sex life and their hormones, like I suppose I can do that too." Like you see that it's possible and then you get a little bit more brave. And it's a beautiful thing.
Yeah, absolutely. Well, this was a really fun discussion. I'm really glad we got to have it. And thank you so much for making time. And I look forward to sharing this with everyone.
Thanks for having me.